Hey, Joshua Austin here. I'm a restorative dentist in San Antonio, Texas, and I'm at the Seattle Study Club Symposium at the famous Biltmore Hotel in Phoenix. And it's a great session here. This is probably my 7th symposium, and it's a meeting unlike any other meeting you ever go to. In fact, when I meet somebody who comes to symposium for the first time, I always tell them no other meeting will ever be the same once you experience this, because it's truly a 5-star meeting. The theme of this year's symposium, and every year has a theme, is the World Treatment Plan Championships. And so groups and clubs have gotten together and have these big cases that they're treatment planning as a competition that gets judged by the colleagues. And the interesting thing about these treatment plans I've seen presented so far is kind of a movement in the zeitgeist here. A little bit back to more regenerative and restorative dentistry on teeth that maybe 5 to 7 years ago would have gotten extracted and grafted and had implants placed. There seems to be kind of a little mini movement of some teeth that were kind of borderline trying to save them and the biologic advantages of that. So it's always interesting to me to see how those things swing. We obviously, before implants were doing all this kind of hierodontics, and then it sort of swung the other way where maybe we went too far depending on implants, and now I see the pendulum kind of maybe coming back to the center of, hey, there are some teeth that maybe we can do some things with that aren't necessarily destined to failure. So it's been interesting to see that echoed throughout a lot of these sessions, and what I assume is in groups and clubs that maybe didn't have any interaction and all had those same thoughts at the same time, which is why I use the word zeitgeist, which I think is a great word to describe that. So the interesting thing is, in a couple of the sessions, people have brought up decision trees and/or the possibility of maybe AI, artificial intelligence-driven algorithms to help us make decisions on some of these tough teeth using big sets of data as actually the background of that, and use that data to make decisions. And so, thinking of AI in dentistry, we think of, maybe recall maintenance and trying to identify patients' risk factors and what X-ray series to take on a patient at what time. But to think about using AI to make granular decisions about a patient's dentition and even an individual tooth that may have these issues and the patient has these risk factors, I think is really kind of astounding to those of us that were around in a day where some dental offices or dental laboratories didn't have a computer in them. And now to think, we're letting AI influence our decision, I think is stark and kind of jarring, but also reassuring that, hey, maybe we have the ability to use big sets of data very quickly and make decisions on things. So I think that's a very interesting concept, and that's something that you see around and that has been mentioned many times here in some of the different sessions. So that, that's always the disconnect, right? Is you come to a meeting on the weekend and then you go back to your office on Monday, and most likely the team didn't come with you to the meeting. And that's a hard thing. It's a hard thing to take those systems in and take those things you've learned. And so what I've kind of learned is, is you do this like you eat an elephant, right? You can't eat it all at one time. And so we need to have little pearls that we kind of incorporate little by little gumdrops along the way. And I really think that's the only way. Change is scary to a dental team. And if you come in saying, hey, we're going to utilize this whole new algorithm to make decisions about treatment planning and do this and do that, and I bought this thing and I bought that thing and I bought that, and we're going to do all this together, that's a lot of things all at one time. And so I encourage people to take it step by step, set a priority list, start with one thing, get that going. If it's a week, a month, a period, or a quarter later, let's move on to the next thing, and let's do it little by little, because it's really hard to revolutionize your practice overnight. It doesn't just happen that way. And so we have to take steps. And so I would say, eat the elephant little by little until you've taken what you've learned here and integrated it, and/or built the practice that you want to build. You can find me on Dental Economics, Pearls for Your Practice, and the Dentistry IQ e-newsletter. And you can also find me at Joshua Austin DDS on Instagram.